Talk about a turnaround. The Great Recession 10 years ago cost Minnesota 160,000 jobs and left 235,000 people unemployed. Today, the story is a worker shortage. Here's Alexandra Renslow with the second part in a series of reports on that issue.
After 9 years of economic growth, Minnesota faces a tight labor market with more open jobs than people to fill them. It's a challenge for employers, but an opportunity for the young.
Our young people, whether they're coming out of high school or whether they're coming out of some post-secondary education, they're much more likely to be able to find that first good stepping stone into a career, much more so than 10 years ago, when a lot of our young people were just not able to get a good start on a career.
And here's an example from the Robbinsdale School District of how our young adults are being trained for jobs that are open right now.
Nursing assistant. So you decide, you be the patient, no, you be the patient and she be the nursing assistant. How about that?
In a high school classroom at Robbinsdale Cooper,
if you feel any pain, please let me know.
A 6-week summer pilot program is in session.
And then walk.
The focus here,
There you go, very good.
is on care.
Okay, we are done, Miss Adeline.
You do want the people that you love and that you're closest to you want to make sure that they're getting the best care possible.
1,
The students in this program
3.
are teenagers.
Perfect. Ask them how he feel first before we take off.
They're training for a job
Pivot to the chair.
in desperate need of workers.
Okay.
Nursing assistants are in such high demand right now.
As the population ages, the need for nursing assistants is expected to grow 11% over the next 8 years. But it's also a lower paying job with a median salary of $27,500, which adds up to around $13 an hour.
You have to start from the ground and go up. There's no starting at the top. This is the bottom. So I'm very excited to be in this program. I'm very excited to start my career from this.
Knock on the door, introduce yourself.
For the teenagers in this program,
once you help them get up, you have to say, are you okay?
Working as a certified nursing assistant or a home health aide,
Raise the bed.
can be a great stepping stone to a career in medicine.
Correct. All right. Now let me see you start your skill.
Haley Engebretson of Crystal plans to work as a CNA while she goes to college for a bachelor's in nursing.
Leave their resident in a safe.
19-year-old Doratu Ahmed knows she will be a better doctor if she understands what nursing assistants do to help patients with daily living.
Emotionally, you've went through most things that post doctors will not see, so you have huge sympathy for your nurses and your CNA. You will look at it very differently, so I think that is so important.
We are actually developing healthcare workers that are compassionate, empathetic, and actually educated in their skill and their craft to be able to care for those that are aging.
After a combination of classroom study, hands-on skills practice, and 2 days of clinicals, an exam is all that stands between these teenagers and nursing assistant jobs. And there's a care facility in Minneapolis already in line to hire them.
They will actually have an opportunity to interact with Augustana at the end of the last week of this course, where they will do the interview process and the questioning and the resume perking up and just preparing themselves for the job. Yes, work ready. Very good, very good, very good. Thank you, thank you.
And coming up on Thursday, we will take a look at the worker shortage in the construction trades industry and how getting teenagers into the right track early could make a big difference.